So my first question is again, thank you so much for being here today and for taking the time out of your day. Um, why don't you, can you tell us a little bit more about yourself and your journey in healthcare, like your education and your background? Yeah.
I'm gonna, if I start crying, don't
No,
get,
don't worry.
just considering it's an old lady's crying.
No, I
Um,
understand. Don't worry.
you know,
I'm
it's really, I don't know why I'm getting so emotional about this. Um, how old are you?
sick. I actually my birthday was yesterday, so I turned
Oh, happy birthday. How old?
23. 23.
23.
Yeah.
Okay. I graduated from University of San Francisco in 1974.
Wow.
And that summer I took my boards to be an RN. And as soon as I passed, I um well I my whole senior year of college I had been debating joining the union. And then um uh when I um when I got my certificate that I passed my boards, I let the union know that I was ready to go. And I one little tidbit of information is I got a letter from Vince Bonta, who is Rob Bonta's father. Do you know who Rob Bonta is?
No.
He is the district attorney of California.
Oh.
Rob Bonta is,
Yeah, okay. Yes, yes.
yes, um he was a little boy. He was a little boy in those days, obviously. Anyway, and his parents were in leadership of the United Farmworkers Union. So anyway, the point is of that story is everything about my education is very related to the United Farm Workers. I'll go back one step before that. In the years that I was in USF, was a time of just the beginning of both um, a lot of different social justice movements, shall we say, and some were connected to the Catholic Church and were committed to a group of priests that believed in something called liberation theology.
Mhm.
And those Jesuits that I was in touch with in USF um, were working also in El Salvador. And so we knew not a lot, we learned introduction to what was happening in that process in Latin America. And I worked with a community of sisters in San Francisco doing community development in the mission. So I had input from different communities for um, why I wanted to do this work. And so I uh, I don't know how I don't when looking back on it now, I don't know how I took that leap of faith and went. Um, as Katie will probably tell you, is we knew nothing.
Yeah.
We had the most. It was like we just trusted. For some reason, we just trusted that we would be able to do this, even though we were massively underprepared.
Yeah.
And if you have you ever read any testimonies in the Farm Worker Documentation
Yeah.
Project?
Yeah, 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 the essays.
Okay, most of them, the common theme is, oh my God, Caesar asked us to do this big thing, and we had no idea how to do it.
Yeah.
And I think that's it. That's a big theme.
Yeah.
And the big theme is how then did we do it? Because we had community. That's the only answer.
Wow.
Because farm workers took care of, well, that's what my answer is. Farm workers took care of us. We had community, and we just worked every day. We just
Yeah.
we just put in every minute. So when you asked, I'm going off course for your original
Yeah.
question, which was education. So I went to USF. I went straight to the union, and us guys call it the union, okay, United Farm Workers of America. And uh, what was happening when I was there was on an educational level was something very interesting. The University of Berkeley, of California at Berkeley, was starting a rural nurse practitioner program. So one of the first people in that program was a nurse that was in Delano before me, Annie. She was already in the program and she was finishing it without leaving Delano. So I applied to that program and I did it also.
Wow.
So I was in Delano for 3 years. The last year and a half, I was a UC Davis student. I left Delano to go to school in a satellite classroom in Porterville, which is just north of Delano, uh, for 1 week a month. I probably stayed in somebody's house. You have to realize we had no money. Okay, so do you know what our salary was in Delano? Do you know what farm worker salary was?
Like
It was it
dollars?
was it was a roof over your head and $15 a week.
Wow.
So again, how did we do that? We only had community. So somebody took care of it. Somebody found us a place to stay in Porterville. We went there. I went there once a week. Then we did that for a year, and then there was a 6-month internship. And the physician in Delano that I worked with, Dan Murphy, was my preceptor. Then Davis would come and check us out at the clinic, and we did not go to the Davis campus.
Okay.
Um, so that's how I became a nurse practitioner. Um, Years later, I'll go back to to Delano, but years later, when I worked in San Francisco General, UCSF was um, made me a master's program, basically. Um, I was a clinical. I wasn't a professor, but I was a clinical preceptor for their graduate school, for their graduate program. But I didn't have a graduate degree myself, right? So I
Right.
was working with their graduate. So they made me one, which they they created a little requirement of classes and a thesis to write for a year. So that I finished in '86. Um, but it wasn't the Davis program was not a master's program at that time, or it wasn't for the most of us. And I had no access to, going to the library or writing a thesis or anything, so I could have never done it anyway. But I got the FNP while I was in Delano, and then the master's came later.
Wow, that's so cool. So you were at Delano before you did the master's,
Yes.
and then that was right after you finished at USF, and then you went back to the Berkeley program.
No, to the Davis.
Davis. Okay, okay,
Yeah.
okay. Okay,
Yeah.
wow. So you were gaining
No,
experience.
no, 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 no. Okay. I went to Davis program was while I was with United Farm Workers.
Okay,
Then, then, you know, 10 years later, I did UCSF's
I see.
master's. Yes.
Wow, okay.
Yes.
That's interesting. How was Davis's program like? How did that reflect what you were experiencing at the farm worker?
Well, we were super lucky that they had a very good thesis to test, which is we need there to be nurses in more underserved areas and more rural areas. How are we going to do that? Well, we're going to go recruit from the rural communities instead of having people come to the program and say, I promise, I'll go work in the valley, in Tehuacán Valley, and then never go.
Yeah,
They wanted to test this idea of what if they just
train.
trained us that were already there, that already had a demonstrated commitment to that community. And so that's why they did it. So they were already focused on the kind of things that we cared about.
Of course. Wow.
Yeah.
So was the United Farm Workers for you, was that an influence, like how did you get the motivation, or the not motivation, but the fight for the United Farm Workers? Or where did that come from? Was it something in your childhood or in your life that brought out social advocacy? And if that
That's
makes
a good question that I have pondered the whole time. I'll tell you what I think it is. Um, I am the granddaughter of a longshoreman in San Francisco. Okay, so I have a history of my grandfather was a longshoreman. My father was in the sheet metal union, and I remember the days of what it was like before he was a union member and after. Like we went to the doctor and we had dental care and he got paid better, and so I had an appreciation of my grandfather and my father's before and after being in the union. And so I already had an appreciation for labor organizing um, that way. Then, as I say, this was pretty, the other motivation was, well, I also was a kid of uh, the Vietnam War was my peers. My peers were going to fight in Vietnam. So I knew that something was very wrong with this country,
Yeah.
and we could not keep focusing on war and not justice. So that was an influence. Then I had this community work that I did with a really super mentor that happened to be a sister of social service, Diane Donahue. So I had somebody to talk this through with. I had somebody as a sounding board for, okay, here's what I'm thinking. And she was a big factor in sort of painting this option for me.
Mhm.
And I don't think I talked to anybody in the UFW that much. Um, I never went to Delano before. In fact, when I applied, until Vince Bonta wrote me that letter, I didn't even know where I was going. I
Yeah.
would just go to whatever
Wherever.
clinic they told me.
Okay.
So then I showed up, and there I was,
Wow.
an RN, just an RN, nothing fancy.
Okay. Wow. So tell me more about how that experience was going into a clinic as an RN. And is this your first experience like in a healthcare setting? Or well, I guess
Yes,
you've
yes. I didn't ever work in a hospital. Well,
okay,
I later in life, but I did not. Yeah, in my whole life, I probably was in a hospital less than a year, and
right.
all my other work is in community clinics and the union. Um, no, the okay, I was uh shy, uh scared, overwhelmed, and nobody in the clinic thought I was ever gonna stay. They thought I was uh how could this little gringa make it? But I just kept at it. And uh Dan Murphy, maybe Kate told you about him. So the we had this set of doctors that were uh, conscientious, whatever they call them. They weren't going to fight in Vietnam, so objectors. So they did their alternative service with the union, and Dan was fabulous. He he was a consummate teacher. He couldn't through every single minute of his life he was teaching somebody something, and he had the patience of Job. So he pushed us incredibly hard to learn more and be prepared and help people in the clinic. Um, so we listened and we did everything he said. Okay, you have to imagine that I was there for 3 years. The clinic did not close for 1 minute in 7 years.
Wow.
So didn't close for 1 minute. So that means that we had very few providers. So we had Dan. We might have had uh, we've had probably we'd had sometimes volunteer doctors would come and help us for a set period of time. We had Annie was already on the track of being a nurse practitioner, but if we I don't know if we ever had more than 3 providers at a time. And have you ever seen what the clinic looked like? Do you ever have any pictures of it?
I have seen
It's
pictures, yes, but I haven't been inside.
it's just 2 big trailers
Yeah.
that meet in the middle. Uh, so we had maybe we had 3 exam room, and then we had a back area that was half like our little urgent care emergency room, and the other half was we had 2 beds there. So we had it. It was it was pretty sparse. Um, Everything worked. We had running water, and we had an autoclave, and we had a little lab, but very sparse.
Yeah.
Um, and so we just started. We started. We as whatever staff came.
Mhm.
Um, we just learned as much as we could, and when Dan Murphy asked us for something to do something, and we said we couldn't do it. He said, "Okay, I'll show you this time, so you do it yourself next time." And so
Yeah.
that's what we did. Yeah, we took so like uh, we saw a lot of patients. I mean, Katie is famous for reading textbooks. I mean, she came with zero health background,
Mhm.
but she knew how to read a textbook. So that was a good qualifier for working in the clinic.
Wow, wow, what a story. Um, so your patients, how was that like defining like a quality of care, or how did you define that in such a sparse setting? And how
Okay, there, it's so it's like for you it must be like us describing another country or something. I mean, if you think that okay, no internet, no uh well, yeah, no cell phones, and we had a lot. Dan was very. If people said, "What can I get you?" He always said more books. So we had a nice library. It was up to date. That was good.
um,
Um, but quality of care was just doing what we could,
yeah,
right? Can you considering there was zero? I mean, if the farm workers did not have us, they had zero. It wasn't and they were very grateful because we were doing what we could and with the resources that we had. And I think for the most part, people understood that and they were grateful. So we did all the basic primary care stuff you can imagine. But thank God in those days, we had 2 big things in our favor that are worse now. We had not that bad, yes, there was problems with immigration, but we didn't feel like you know, the migra were there at the door. We weren't really thinking about them. The other thing is we didn't have a lot of obesity, so we didn't have like terrible chronic diseases
yeah,
that you have now.
like
So that I think that mattered. Um,
diabetes and yeah,
Not nothing to the degree that it is now.
okay.
So we were taking care of a lot more acute things like TB and schistosomiasis. Do you know that we had Yemenis patients?
No, I heard
So
actually from Dr. yeah, from Katie from Dr. Kobe.
yeah,
Okay.
yes. So we had infectious disease. Again, like it's okay. So like one of our first jobs, well, Katie and me, one of our first jobs was to go check on patients with tuberculosis and bring them medications, give them shots wherever they were. And the same with the men that have to come in and give stool samples and check on the schistosomiasis, which nobody knew how to treat, but Dan. So we had, so that's why I think of it like almost more what you think of, third world infectious disease problems. We certainly had those. We had yellow fever.
Wow.
So that was real, and we treated them in the clinic. So that means us
Yes,
hanging IVs, giving really challenging medication, amphitoxin B. That's hard to monitor. Sitting by their side, praying they don't get some bad reaction to the medication. So we had, so that's why I think of it. We had one collection of infectious diseases that was a time consuming thing that we were sent off to go take care of.
of course. And what was your experience like treating this population with infectious disease in terms of infectious disease? Like, do you have any like a story or something that you remember that stood out to you in terms of like the pandemics like HIV or AIDS or H1N1?
We see that's
Different.
after our time.
Yeah.
Yeah, we're not in that world. We're 10 years away from AIDS,
Mhm.
or 8 years away from AIDS.
Yeah.
And so we don't even have that. We had a lot of STDs. I mean, we had real syphilis, real gonorrhea, like real, I mean, progressed, advanced.
Okay.
So yes, that was a much bigger problem. Do you know we had do you know that Filipino men were not the next to the clinic or across from the clinic in 40 acres in Delano is something called the Agbiani Village. Did you ever hear about that? The Agbiani Village was um, built for the retired farm workers, Filipinos,
Okay.
who, when I was there, they were all over 65, shall we say, unable to work, but they had never married because they weren't allowed to marry. They weren't allowed to be with non-Filipinos.
Uh-huh.
So they had a lot of tertiary syphilis. So we were still taking care of the consequences of their lifetime syphilis. So that's why we weren't thinking about the same disease set you are now. We,
Yeah, of
we were
course.
still in the infectious disease story. Um, and so we we were very, very attached to the Manongs, the older Filipino men that were there. They were like all our uncles, and whatever they needed, we were very uh, close to them. And that wasn't a gigantic group, but they were emotionally very close to us.
Wow. How was your access to medication at this time? Like specifically with
Yeah.
syphilis, like antibiotics, was that something that was
Well,
accessible
it
for
was a priority in terms of the budgeting, and uh, so, and I think we had I don't know how we did it, but we had all kinds of strategies to buy medication, and so we had our own little pharmacy,
yeah.
and we did it
Wow.
somehow.
Okay.
Yeah, but then so we had the infectious disease. We had injuries on the job, like
Mhm.
lots of uh, well, had both injuries and the effects of pesticides. So the plain old injuries, like abrasions and sore backs and all that regular stuff. And then yeah, what I always remember, one story about injuries is the one that used to get me the most is, in those days, farm workers had to manually collect the pipes of the sprinklers that went in the fields. They had to screw them and unscrew them. And it was in the winter, it was really cold. And I just remember older men with terrible, terrible arthritis in their hands, and how hard that was to do. And it
Mhm.
was back-breaking work because they had to carry those heavy pipes too. So just, the work of farmers. Also, we had a strike in this rose field called McFarland Rose.
Mhm.
And we had a strike there. Um, but what they had to do to prune the roses, the rose bush, they weren't picking the rose flower, they were pruning the bush. They laid on their stomachs on a pallet with wheels and sort of pushed themselves through the fields, pruning at a low to the ground level of the roses. So there's a lot of it, farm worker is killer on your body. And these people did it for their lifetimes. So lots of uh, those kind of problems. And, we didn't have an exercise class to send them to or a physical therapist or anything. We got through it. So that category of,
A lot of the times they never had like days off, right, after an injury or things like that that never was
you
something
don't,
access to.
well, if you didn't work, you just didn't eat. I mean, you don't go to work, you either might lose your job completely or you just don't get paid for the day.
Right. Wow.
Yeah.
That's
The probably the biggest impression was going to labor camps. I
yeah.
mean, going the biggest story I always tell people is, like I just said in the beginning, the only way we survived was community and because the farm workers took care of us. And the biggest demonstration of how farm workers took care of us, to the degree that they took care of us, we um let's okay, little kids. I remember having little kids with pneumonia that we couldn't hospitalize. I mean, these days babies get hospitalized pretty quickly.
Mhm.
We didn't have that option, so we had to go see them twice a day and either give them antibiotic shots or just be sure that they were okay. And I remember going to a labor camp uh, when it was pitch black and everybody was asleep. The farm workers have to go to sleep early because you have to get up at like 4 in the morning to be at the fields. So we go to the camp, and there were metal drums with fires in them. Have you ever seen those oil drums with fires? And we saw some men standing around the oil drums, and all we would do, we would just say, "We're from the union. We're from the union. We're nurses. We're from the union." And they would just, and we'd say, "And we're looking for the Sanchez family. They have a 2-year-old. We have to find the baby." And they would take us. I mean, we walked into the night of a bunch of farm workers in a labor camp
Yeah.
in the middle of the night. And we never thought, "Oh my God, is this safe? Are we going to be okay?" We just thought, "Oh my God, am I going to be able to find the baby?"
Yeah.
And they took us. We found the kid. And I remember this labor camp, it was so bad. We turned on the light. I don't know if you've ever lived with cockroaches, but we turned on the light. The cockroaches go all up the sides of the walls. We step over men on the floor in sleeping bags. And then we try to bring the baby to a little corner of the kitchen to see if they were breathing okay. And we did it, and we left feeling so relieved that the kid was all right, that the whole process, of getting there and what the conditions were and all of that were so secondary. I mean, we didn't even, there wasn't it wasn't our duty was to that baby, and we were going to go get that baby. And if it wasn't okay, we were going to figure out how to put it in a car and drive to
Yeah.
Visalia or somebody to beg somebody to admit it. But we we were we were very well taken care of by
Yeah.
farm workers.
Affected. Yeah.
It sounds sort of romantic, overly romanticized, but it really wasn't. I mean, there's some very, very hard things that you think I cried a lot today. You should see me how many times I cried before. I mean, it was really, really hard. It
Yeah.
was really, really hard. But the the satisfaction that sometimes we could help people,
Was enough.
yeah.
I bet. Wow. Okay. That's it's hard. It's hard to overcome it, and that's an experience that that, I bet it remains like a profound reflection as to your service. Um, can you can you tell me or describe what role was like policy change or like advocacy, like the RFK medical plan, like something that was wanting to help this situation in the clinics, and how it improved care? Like, were there any things that were being set in to improve this situation in the clinics, or like your?
Well, everything we had a one track mind. Make the union strong. We were one track. Uh, to make the clinic strong, we had to get up with the farm workers and go to the picket lines.
Yeah.
You want to make the clinic strong, you make the union strong. Before you go to before your shift starts at the clinic, your day starts at the clinic. There's no such thing as a shift. Your day starts.
Yeah.
Go walk the picket line. I mean, we had it wasn't it wasn't a small focus. That was the whole thing. Okay, so then we could go out. Then we had it in our mind. The bigger Nobody was explaining to us policy on a socioeconomic level. They were just saying who's going to pick you up in the morning and
Yeah.
what fields are you going to go to. So that's one aspect of it. We were at every farm, every time, practically every Friday night, there was a farm worker meeting in the hiring hall, and we were at every one. So we got the big picture, let's say. Um, but on a smaller level, on the clinic level, it was all directed by the medical director, by Dan. If he was worried about something, like the schistosomiasis is a good example. Here's a problem. It's not being taken care of. We have nowhere else to send these people. What are we going to do? We had kids with cancer, for example. We couldn't make everything. We couldn't make a policy decision because we didn't have we only had so far of a bandwidth. If we said, are we going to start seeing kids with cancer? Oh my God, how are we going to do that? Well, we called UCL. Somebody knew somebody at UCLA, and we said to the teaching staff, can we have a relationship with you, and you take our kids? And we had a little boy, Ephraim, with leukemia, and some his care was at UCLA, but we can't just give them a farm worker a piece of paper and say, oh, go to UCLA. There's this like doctor there that's going to be waiting for you. We'd have to do every step of the way. We brought those doctors to Delano to meet these kids.
Yeah.
And then we figured out a shared relationship and what meds we could give them ourselves and when they go to UCLA and blah, blah, blah. But it was almost on a case by case level because we couldn't create a policy because we had no resources to do a policy. So that's a completely different, way of thinking. How much we were beggars. We were organizers and beggars
Yeah.
for that is our advocacy,
Right.
because where were they going to go? Who would see us?
Yeah.
And so Dan had to try to create some relationships with some of the doctors, like if our patients did C-sections, which we had an outrageously low C-section rate. But you realize that we delivered babies in the clinic. Did you know that?
Yeah.
Yes.
That's crazy. I was talking to Dr. Colwell about this, and I wondered how like pain management and medications were
Oh,
given to women who were going through childbirth. But she said that natural childbirth is not, it's painful, but it's, you hold on.
well, yes, we believed it and practiced it ourselves,
Yeah.
but that that wasn't even like
No.
in our wildest dreams. I mean, we had babies being delivered in the clinic while clinic was going on, and it was more like the waiting room was the rooting section, waiting to hear that baby cry. No, we did about one for some months there. We were doing 30 births a month.
Wow.
So the babies, we would have a regular clinic with regular hours. A woman comes in labor, and we go, okay, Dan, when we tell you it's ready, this baby's ready to come, just your patients are going to be sent home because we have a baby to be born, and that was just that. And then they would, he was magic. Those babies, we, I don't hardly remember sending any babies away, women away. I remember, just seems like somehow or other, all of them were born in the clinic. Um, and then they recovered in those two beds in the open space. It wasn't a closed room.
Yeah.
I mean, we had a closed room for the where the babies were born with just an exam room. It was very cozy in there.
Yeah.
And then the babies were born, and we had those two beds, and they stayed with us until
Until they felt
I don't know. We felt like they were ready to go home. The biggest surprise thing is one winter day, we had a woman come in labor with twins. Oh my God.
And a lot of these women, let me just clarify, a lot of these women are working in farms. Yeah, okay, okay.
Yes. So they are their husbands, are farm workers. They're in the union. They have our wonderful benefit, but
Yeah,
we have very little money. So what? We had a health plan with a very small budget,
yeah,
right? So Dan decided we were going to be able to deliver these babies.
yeah.
I, I don't know how they, we did, but the twins were the big deal because the twins, I don't know how much they weighed, but they were probably a decent sized baby. I
Oh,
mean, they weren't 3 pounds. They probably were at least 4.5.
wow.
Um, but it was freezing cold. We literally, we literally used desk lamp. I mean, the lamps that you use to do like a vaginal exam, just like in the exam room lamps. We had two little, not isolettes, just two little crib things. And I don't know if we even used cotton, but we wrapped them up as snugly as we could.
This is
We
cool.
put the lights over them. Our quality control was putting our hands under the light to be sure it wasn't too hot.
Oh.
And I don't know if we probably kept them overnight, but we couldn't send them home because they lived in a labor camp.
Yeah, that's a key point.
What did I do for the problem? I went to the priest and I begged for money. I said, we have to do something to this room because there's no insulation in the place in the labor camp. So we got plastic, sheeting,
Hmm.
and I don't know, we must have tacked it or nailed it to the walls. So we kind of lined the room with plastic sheeting. We got a electric heater, like a plug-in heater. And we checked some leakage of air, and we tried to see if we could heat up the room.
Wow.
And we did. And then we went and got the babies and brought them back
Hmm.
to live there.
Yeah,
They lived. They lived, these babies. And the dad was so happy with us.
yeah.
He said, "Give me the keys to your car. I'm going to put something in your trunk." And it was an orange grove. And I opened my trunk, and they had this huge conveyor thing that dumped out the oranges in the delivery trucks.
Uh-huh.
They filled the whole trunk with oranges. I
Oh,
got paid in oranges. I was so excited. Anyway,
cool.
um, uh, because it just seemed impossible that these babies were going to make it. So we went every day to visit the babies, and uh, I don't know. We had guardian angels, luck. I don't know, goodwill. The babies did it. So there's a lot of things where how did this happen?
Yeah.
Somebody would think we were doing child protective service on us for sending these babies to a labor camp. But, you know, yeah, give me some other place to send them. I'd be happy to do it.
Wow. That's impressive. Um, so so after this, you became a nurse practitioner, correct? How was your training as a nurse practitioner? How in your experience at the clinics, how did that shape your experience training as a nurse practitioner
Well, it
and
was seamless. I mean, like everything, I had to do an academic thing, which was, for me challenging. And I had it, but it was everything I learned was applicable the next day.
right?
So yes, I needed it before I learned it.
For a lot of your peers in this program, were you did you feel like that experience in the clinics was a fundamental part of shaping you as a nurse practitioner?
For forever and ever, amen.
Yeah,
And again, if you read those essays, practically, I haven't met a person who hasn't been affected for the rest of their life. That's why I tell people about Ron Bonta. He was about 7 years old when he lived in the Tehachapi Mountains with Caesar and all the UFW kids that were up there in La Paz. And now he's a, district attorney. I mean, there's a lot of people that are in that category. I mean, Katie went to medical school, right? And then I stayed in community clinics my whole life. You really feel it was a very compelling experience, shall we say.
um so do you feel like that public health has really changed in terms of how like throughout all your years at the clinics, how do you feel it's taken like a transformative approach, like how has public health really um transformed in your time as a clinical nurse and then as a nurse, a registered nurse, and then as a nurse practitioner?
Well, I mean, right now there's Medi-Cal for undocumented people.
Yeah.
That's a miracle. I mean, we didn't have that. So I think that there's access to healthcare more than we had in those days. So that's a great thing. Um, there's a bigger network of of community clinics in the San Joaquin Valley.
Mhm.
So what I think is personally is that public health is worse in some ways, and access to healthcare is better because worse is, you know, our patients. I mean, uh, Latino immigrants are terrorized by this immigration policy. As I said, obesity and chronic disease are terrible, and respect for people is not not looking good right now. So the mental health thing is it's so much worse. The the chronic disease is worse, um, but access is better, and the water. Now when you're people don't live in labor camps like they did. Well, at least families don't. Um, you know, Water quality is better. There's some rules about pesticides, so there are there's there's a plus column and a negative column.
Right.
I,
Okay.
I, we were happy. We we we. I don't think people felt so. Depression and anxiety wasn't overwhelming. Yes, burdened. People were burdened. Yes, but uh, I think it's a lot harder in some ways today.
Yeah, of course. I mean, it's very um it's looking at what happened in the last couple of weeks with healthcare, especially with what's going to happen in the next 4 years is extremely um daunting and troublesome to think about, especially for Latinx communities and farm workers. And that's a step that I don't think that is going to be easy to take. Um, that being said, if you could tell yourself um, a piece of advice to before you started as a registered nurse at the clinics, what would you say? What would you tell yourself if you could?
Oh my God. It's such a mixed blessing because, well, all of us would say we wish we knew more.
Yeah,
We wish we had more skills and more to bring to the situation, uh, because you feel like it's never enough, and oh my God, I'm exhausted and it's not enough, and how am I going to do this? That feeling was every single day. That is the part that brings me to tears now. Like I um it's like when you're confronted by any horrible injustice and it's on a visceral level every day, and this is rotten, this isn't the way it should be,
yeah.
and you struggle. That is a hard thing. So basically, study hard and be prepared so you have so you can keep in the fight. Now, how do you keep in the fight?
Yeah,
That's that's it's a tumble. Those two things have to come together. Yes, over my life, I got more prepared. Okay, over my life, I learned more. But how do I keep working in a system that is horrible? Look at how many doctors and nurses are quitting. Look
yeah,
at how people feel about healthcare right now. I think we were so, that's why I keep going back to community. We were so lucky because, as bad as things were, we lived in community, we worked in community, we were animating each other by community
yeah,
on our worst, worst days. And I don't know how you create this now in this isolating environment that we live in.
yeah. It's complicated. The lack of like camaraderie is something that's very real. I mean, like experienced this is a very just a not a very inclusive example, but I mean, just being at Berkeley as a student is like very competitive, and there's a lot of people that are not. I mean, it surprises me how future doctors and nurses are very competitive. I mean, there's not a support to your peers, and that's something that's very scary in the future of how we're going into healthcare now, you know?
I wish, and well, Katie and I we're very opinionated in our old age, but one thing that I blame is the schools themselves. Like, what does our society need? Are you going to look first at what does our society need, and how do we prepare students to do what society needs, and how do we choose the students who are willing, like I said about the Davis program that found us in the rural communities already working there. But when you just keep people who are out for themselves and their own richness and their own self-aggrandizement, even personal fulfillment, it's so selfish. How are you going to become change agents? They love that word and they all think they're change agents.
Yeah.
But if they're thinking of themselves first, they're not going to change anything, in my opinionated old lady view.
Yeah, I mean, yeah, they're only looking for themselves in a system that was built for them to succeed, right?
Yes, yes. And
Compli-
blame the people at the bottom for their lack of success.
yeah,
The part that is the most infuriating to me is how people of means judge people who are struggling.
yeah,
And if a university system who thinks they're so high and mighty hasn't figured out how to do something about that, it's a pretty sad commentary.
yes,
And they want all the universities want to know that what's the top 1%, and did we get the people with the highest SATs and the smartest ones who are all going to go to grad school? Yeah, yeah, yeah. But then they're going to be things, they're going to become people we
human.
really don't need. We
Yeah,
need, who's going to go right now, any doctor who's working in the San Joaquin Valley, or or in the Imperial County, to me is a hero, is a missionary hero, because the ones who are working in San Francisco, I mean, here I am in the Bay Area myself, but they're the subspecialists that are here are having a wonderful life, and I'm happy for them. But there's you're never going to solve the problem of people in struggling communities if you don't get enmeshed and immersed in them. Is the lesson Caesar was adamant about.
Yeah.
Adamant. You-
Yeah. Wow, that's a very I needed to hear that point. It's very easy in this in my I mean, I've been struggling a little bit because I'm going to apply to medical school soon, and I'm very focused on my grades, you know? I mean, it's hard.
yeah.
It's competitive, you know, and I sometimes forget to realize how my experiences you are necessary, and these experiences and how I grew up is necessary. So that's something that I needed to hear, because it's not just you have to be human first, and a machine is not going to be a good doctor. So that's something that, or you know, good
Well,
provider.
it's going to be a good doctor, but not for enough people. There's going to be the haves and the have-nots in everything. And when it's also in healthcare, it's just unacceptable. And we have so little healthcare,
Yeah.
and, and so little advocates for public health in rural communities. I mean, if I don't know, where did you grow up? Where,
I,
what,
I grew up in Mexico City, but I moved to the US when I was 10. So I've been here for a while. I moved around the US. I lived in Connecticut. I lived in Los Angeles, San Diego. So I've had a very enriched I you know childhood. I was able to experience a lot of different cultures. You know, my parents are very um open, so that was very helpful. But it is complicated because I feel like I'm in a system that is very focused on one goal, and that's like being the top, and that's not very, I think, human. But
well, it's hard. It's very hard to do that at the same time of being grounded in, well, what Caesar would say is, in in and focus on injustices. I mean, it's very hard to work that hard for your own professional development without losing focus on those issues in the world. And then you feel, well, not you,
yeah, yeah,
Daphne, but people feel like, oh man, I struggled so hard. I worked so hard. I
mhm.
deserve to have a cushy life or whatever. And I mean, I I understand. I mean, everybody does. But what do you do with that segment of the population that's getting nothing? And who is going to be there? And are you going to keep importing immigrant doctors to work in underserved areas, or are you going to take that responsibility yourself?
Right.
So that's just the issue from the justice perspective,
Mhm.
and well, from the life experiences, I think one of the reasons, I don't think Caesar did this on purpose, but well, he did some things on purpose. In a one way to keeping us poor, keeping us unsalaried. I mean, we had no salary, nothing. I was on Medi-Cal myself. I got food stamps. I, didn't have anything. We didn't come with a little reserve in our pockets from our parents. We came with empty pockets, and we kept them empty the whole time. But it was a way to be much more enmeshed in the population, and much more in need of community and each other, because there was no other way to survive. And I think that was as important. I mean, of course, we were very privileged because in a minute we could walk out the door and go to our middle class lives. But I mean, at least when we were there,
Yeah.
we were as enmeshed in the community as possible. So it's impossible. So it was much harder to not be
Right.
empathetic. to it. It's not ours. Well, the other thing that I think is wrong about some movements now is um, we were all in the farm worker movement. So we didn't have to be an ethnic group. We didn't have to associate with one, you
Mhm.
know, grouping or another because we were equal in the farm worker movement. I was a member of the union just as much as a farm worker was a member of the union. So we had a lot of sort of
It was all,
equality that way.
everyone was there for the same purpose and the same goal, and that coalesced the mission, right? The mission of the UFW
Yes,
and the
yes, but it kept no separations. There was no like little side anything. We were one, no fighting. Everybody get along. Everybody work things out. I have one. I'll tell you one more story.
Mhm.
That Dolores. Okay, so when I was in the clinic, Dolores was not there 100%. Caesar wasn't there 100%. They were in and out. But Dolores had her last baby, Camila, uh, uh, while I was in the clinic. Anyway, so I knew her pretty well from because of Camila. And one day she was showing a bunch of uh, Chicano students around the clinic, and she introduced me to them and said, "This is our director of nursing." And somebody in the group said, a man said, "How come you let that gringa be in charge?" And she tore him to pieces. She said, "She is here 24/7. You guys come in for the tour, but then you never show up."
Yeah.
And the the thank God, I was so relieved because, well, first of all, Dolores or Caesar could have criticized us for, I mean,
Yeah.
we have a standard. Don't worry. Behind closed doors, we could be in trouble for a lot of things. But on that point, they understood that those of us that were there the whole time, that was the point. That was the only point, really. Are you here? Okay, you made mistakes. Okay, I
Yeah.
mean, basically, what we got in trouble for was taking care of people that turned out to be scabs. That's what we get in trouble for, stuff like that. But
Yeah.
anyway, um, but I think it speaks to the equality of you're in the movement, period. You're all one, whatever your background is, whoever you are, the mission's the same.
Yeah. Wow.
That, thank God that happened. I
That's,
was so young.
I'm glad
I
that,
so didn't know anything. But at least in public, Caesar and Dolores would support us.
yeah, of course. Wow. That's, wait, so what year did you end up leaving the clinic? The clinic,
77.
77. Okay.
Yeah, I say I had a 3-year job, which means 3 years means 0 minutes off.
Yeah, I
I
bet.
we slept over. We took turns sleeping over.
Wait, so how okay, so looking back, what do you think is the most like critical legacy of the of that clinics? You were talking about collaboration and like in and camaraderie and the unions, but like what do you think is something that we can take to like today's healthcare programs, like from the clinics, like in terms of actual like clinical care and or something like that stays with you or something that you want to take to today, if that makes sense. It's a question.
Well, I think we were clear about the priorities. We had a clear idea of what matters the most because we lived it so intensely. And when something, so that was, I think, um, I think you can't always clarify priorities, not just of your own interest, but what are what are the people's needs on the ground, and how are we going to keep listening to that and be sure that's our order of attention?
Yeah. I might be wrong, but it feels like it's like a little bit fight or flight. Like it's like people's these are people's lives, and it's very you have to commit yourself 100% to this. And there's no and I feel like now or what I've experienced now is very like technical, right? There's laws and there's like things that you can't do and you can't stay for this time or you can't this nurse like can't like for example, I can't be a medical assistant without this like training or something like that. But it's in I feel like in this time it was very much based on your level of commitment and more of your own qualities of yourself that make you able to be in this to help this population, right? Do you feel like that's something
Mhm.
I
That's absolutely true, and we still make, and it doesn't mean we didn't make mistakes. I mean, we had to prioritize that because in the long run, the commitment was going to be more important than anybody's individual area of expertise in the big picture.
yeah.
But of course, expertise is welcome, but the commitment came first. So let's say, for example, I was so scared of the medications for valley fever,
Mm-hmm.
and so what did I do? I stayed all night. I just there was two beds, literally. Patients here, I'm here. I'm just sitting there, watching, being careful, doing everything I can because time. What we didn't have in expertise, we had in time, and
Yeah.
we prioritized people. Like going to visit babies in labor camps. We
Yeah.
hoped the medication we gave them was good enough. We hoped they were going to be okay. But how did we know? We better go look again. We better spend time.
Yeah.
So we did. That's what we did. But it it's very hard to answer policy because we
It's not lived. It's not something that you it's not a lived experience.
it's not a luxury we had.
Yeah.
I mean, it would have been a good idea if i- if we had any resources. I mean, you create policy when you have a abundance of resources, and you figure out, okay, how are we going to use these resources in an efficient way? But when you don't have the resources, y- the policy is pretty limited.
Yeah.
You just have to do what is before you.
Yeah, of course.
Yeah.
Um, for my final couple questions, I wanted to ask you, how can I take or from your perspective, how can these stories of these experiences and this ethnographic like collection of an experience, how can they influence like current generations that are going into healthcare and future generations? Like, how do you see that there's a way that these stories are I'm this is an easy question. Like, yes, but how do you see this helping?
Um, if 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 talking to one person, like just what can I say to you, Daphne?
Mhm.
That um, healthcare is going in a direction where they want you to do the 10 or 15-minute visit,
Yeah.
and you never listen. I mean, every time we talked about how to be better providers as nurse practitioners is, okay, when you have that 3 minutes to listen, try to concentrate as hard as you can.
Yeah.
Huh, how do you do that? How do you do that? Um, I'm very in mourning over the fact that providers don't get oriented to listening to their patients. And that's that's a big loss. It's a big loss to be so compartmentalized, like all the socioeconomic problems of a patient are for, oh, that's for another department. And you as the physician better hone in on what your adjustment you're going to do to the blood pressure medicines.
Yeah.
Um, it's it's but that's I don't know what it seems like such a luxury to even have those discussions right now since healthcare is in such a demanding, unsettling state for people,
Yeah.
But I hope I hope that medical providers I don't know, are not treated so badly. I mean, we're in such a bad place after COVID where uh, there's so much healing that has to have in the patient provider relationship.
Yeah.
And it's bad enough in the most affluent situations, but it's really terrible in the
Understand.
more struggling communities. And I don't know how to heal that relationship without a little more time and listening.
Yeah.
And now you're kind of in a war of, misinformation and terrible health policies that might be
Getting worse.
right. So I don't know how you do it. I mean, because your self-care is just got to be so important. Um, yeah, I mean, Katie, I don't know. She she lived through these years and being a doctor in Richmond Clinic with lots of gun violence on the street.
Yeah.
That's a lot to ask of providers. It's a
Hmm.
lot to ask. And now we're asking providers to have, take care of patients who are in rage and anger.
Yeah.
Kate, when I was in San Francisco General, I lost um, colleague physicians that were killed in the Potrero Hills Clinic one day,
Hmm.
and a patient came in the clinic and killed the doctors,
Well,
and it was how do you it
so
was it though that was a during the AIDS epidemic actually. That's when this incident happened, nothing related to AIDS. It's just that the
yeah.
emergency room was full of men dying from AIDS and the victims of this man's shooting. um it's not, how do you ask doctors to be more kind to their patients when this is the backdrop?
Hmm.
It's pretty horrible. And yes, what you said before, I think public health is the main thing. I think that between the problem of misinformation and the consequences that brings to poor public health policy, it's really devastating. So I don't even know, you know, I don't even know where to start because there's so many issues on the big picture. And that's why I come back to community
Uh-huh.
and finding a community where you can feel grounded and live it.
Good. Yeah. Wow. Well, this is what this hopefully this project is. I mean, that's the goal, right? Really connecting and documenting the stories of the underserved and the people who risked their life and gave their life for this community. And thank you like for everything and for talking to me. And like I said earlier, I would kill to be like a slither of what you have accomplished and what you have given your life
Oh,
to. That being said,
well,
or go ahead.
no, we had, yeah, we uh we had it was a privilege. It was a privilege to be part of farm workers in those days. Um, we it, it's a it weighed on our minds our whole lives.
Yeah,
It's
transformative.
it definitely it definitely was, and it made us confident. You know, that's the other thing. Even though in the union I was always worried that I wasn't enough, when I left the union, I think I had confidence that
Mhm.
I knew something about what the struggle's about. That's what I learned. I learned, yeah,
Yeah,
what is it what does it mean to be in the struggle for justice? What does that mean? Well, we certainly learned that. That I'm an expert
I like that. That's a quote. Good quote. Okay. Well, I wanted to just ask you, if it's okay, I might contact you again because I wanted to really reflect on this interview. And I think I have more questions, but I just wanted to really reflect and see where I'm at. Is it okay if I
at. Anytime,
okay,
anytime.
okay.
I couldn't be happier with your
Yeah,
just meeting you and knowing your work. I couldn't be happier.
thank
I'm very proud of you.
thank you, Carolyn. That means so much. Okay, well, I'm going to look over this and I'm gonna reach out to you after the new year. And maybe we can schedule another interview if that's okay with
Sure. Or you can tell me to be more specific and not
no,
go
no,
all
no.
over the map.
This was good.
Uh,
No, no, no. This was perfect. This helps me so much. You have a lot of experience in the clinics, and I think that there's so much you could share and help our project with. So I think that it'd be really cool to have a relationship where we can just get more of your experience and your perspective. And
and so so Katie, Katie and I were only together. Let's see, we were okay. I call her Katie, but she likes to be called Kate. But anyway, I have permission. Uh, we were only together for a short time, really, because she did a much harder job because she had to go clinic to clinic. Anyway, um, yeah, so we have a different perspective, but
yeah,
we,
no, but
we came from,
useful. Yeah, that's so sweet. That that and
yeah, that's so sweet that we're best friends for 50
yeah,
years.
that's very
Isn't
valuable
that a funny thing?
for life. Yeah, friends for life. That's wow. That's very reflective of who both of you are as people and and how
And
you
we kept doing overlapping things, She loves Guatemala. She made me love Guatemala. So now we have a Guatemala connection. I mean, so we kept doing overlapping things in our lives because of each other.
oh, that's a beautiful bond and relationship. I hope to experience that one day.
Yeah.
Um, well, Carolyn, thank you so much. I'll let you get on with your day, but I will just message you over the next year, and I hope that you have a happy holidays. I thank you for your perspective. It's been really grounding, and um it transforms like me and my my career goals. It really aligns with it. So I really appreciate you and taking the time out of your day to talk to a student and really advocate. So thank
You're what we live for, Daphne. You're what we live for.
thank you.
So thank you so much and have a great holiday.
Thank you. You as well. Bye. Good day.